Pain. It is one of the most common human experiences. From headaches to menstrual cramps, from toothaches to muscle aches, we all go through it. But what if there was a medicine designed to ease this pain quickly and effectively? One such drug is mefenamic acid. For decades, doctors have prescribed it to millions of people worldwide. But like every powerful medicine, it comes with its benefits, its uses, and its possible risks. In today's video, we'll uncover everything you need to know about mefenamic acid, explained simply with no medical jargon. Stay with me till the end, because understanding this drug could change the way you deal with everyday pain. Mefenamic acid belongs to a family of medicines called NSAIDs, non-steroidal anti-inflammatory drugs. You may already know other NSAIDs like ibuprofen or naproxen. Just like them, mefenamic acid works by reducing chemicals in the body called prostaglandins. These are natural substances responsible for pain, fever, and inflammation. Think of prostaglandins as the alarm system of your body. When you get an injury, infection, or even natural body changes like menstruation, prostaglandins are released. They tell your body, something is wrong, pay attention. You feel pain, swelling, or fever as a result. Mefenamic acid works like a silencer for this alarm system. It doesn't remove the root cause of pain, but it reduces the signals so you can feel better. The benefits of mefenamic acid mainly lie in its ability to relieve pain and inflammation. Let's go through them one by one in detail. One of the most common uses of mefenamic acid is to relieve period cramps. For many women, the monthly pain can be severe enough to disturb work, studies, or sleep. Prostaglandins are heavily involved in menstrual pain. By lowering their levels, mefenamic acid helps reduce cramps, lower pelvic pain, and improve comfort. In fact, in many countries, it is one of the first-line medicine prescribed for menstrual pain. Many patients take mefenamic acid for tension headaches and certain migraines. While not always the first choice, it has shown effectiveness for people who cannot tolerate other painkillers. After a tooth extraction or dental procedure, dentists often recommend mefenamic acid. It reduces the swelling around gums and eases pain quickly, allowing patients to recover comfortably. Sports injuries, sprains, and even conditions like arthritis cause inflammation. Mefenamic acid can provide relief from stiffness, swelling, and joint pain. For elderly patients with arthritis, it helps them walk and move with less discomfort. Like other NSAIDs, mefenamic acid can reduce fever. This is not its main use, but it can be an added benefit when treating painful conditions linked with high temperature. After minor surgeries, patients often experience pain due to tissue injury. Mefenamic acid can be prescribed to reduce this pain and help in recovery. You may wonder, why mefenamic acid when ibuprofen or paracetamol are everywhere? The answer lies in specific effectiveness. Paracetamol, acetaminophen, is excellent for fever and mild pain, but it doesn't reduce inflammation much. Ibuprofen is good for both pain and inflammation, but sometimes not enough for severe cramps. Mefenamic acid is particularly effective for menstrual cramps and inflammatory pain. That's why many gynecologists prefer it for women who suffer monthly. However, because it has a higher risk of stomach-related side effects compared to paracetamol, doctors usually recommend it for short-term use, not long-term daily consumption. The most common dose for adults is 500 mg as the first dose, followed by 250 mg every 6 hours if needed. Some doctors prescribe 500 milligallons 3 times daily, depending on the condition. For menstrual pain, the advice is often start the medicine as soon as pain begins, or even 1-2 days before period. If cramps are predictable. This way the pain can be controlled before it becomes severe. And this is very important, always follow your doctor's instructions. Do not take it for more than 7 days at a time unless advised. Always take mefenamic acid with food or milk to protect your stomach. Do not lie down immediately after taking it. Give it 10 to 15 minutes. Do not mix with alcohol, as this increases stomach risks. Avoid combining with other NSAIDs like ibuprofen unless prescribed, as this raises side effects. Now let's talk about the other side, the risks. Most people tolerate mefenamic acid well when taken for a short time. But like all strong medicines, side effects can happen. Stomach upset, heartburn, nausea, diarrhea, dizziness. These are usually temporary and improve when the medicine is taken with food. Stomach ulcers, sore bleeding. Long-term use can irritate the stomach lining. Kidney strain. NSAIDs can reduce blood flow to kidneys, dangerous in people with kidney disease. Allergic reactions. Rash, itching, swelling, or breathing trouble. Rare but possible. Heart concerns. Like other NSAIDs, long use may slightly increase risk of heart attack or stroke, especially in older patients with existing heart disease. Pregnant women should avoid it, especially in the last trimester. Breastfeeding women should only use it with doctor's approval. People with ulcers, kidney problems, or blood clotting issues should be very cautious. Imagine this. A young college student struggles every month with severe menstrual cramps. She tries hot water bottles, rest, even paracetamol, but nothing helps. Then her doctor prescribes mefenamic acid. She takes the first dose at the start of her period, and within an hour, her pain reduces. She can attend classes, study, and live normally. Now compare this with an elderly man suffering from arthritis. He tries mefenamic acid for joint pain, but after a week, he develops stomach upset and black stools. His doctor immediately stops the drug and switches to another safer option. These two examples show the balance. When used right, mefenamic acid can be life-changing. When misused, it can be harmful. Most experts agree, mefenamic acid is best for short-term, targeted pain relief. It is not meant as a daily, long-term drug. Organizations like the World Health Organization and national medical boards include it in pain management guidelines, but always with caution. Doctors usually suggest it for severe menstrual cramps, short-term dental or surgical pain, inflammatory pain not relieved by paracetamol. But they also recommend monitoring patients, especially those with stomach or kidney risks. International brand names Mefenamic acid is sold worldwide under many brand names including Ponstan, very common, Ponstel, Mefacid, Ponala. Different countries may use different names, but the active ingredient remains the same. So let's sum up. Mefenamic acid is a trusted NSAID medicine mainly used for pain, especially menstrual cramps, dental pain, and inflammation. It works by lowering prostaglandins, the chemicals behind pain and swelling. It is more powerful than paracetamol for cramps, but also carries higher risks, especially for the stomach and kidneys. The key is right patient, right dose, right time. When taken carefully, it can improve quality of life, helping students focus, mothers rest, and patients recover from pain. But when taken carelessly, it can lead to serious harm. If you found this video helpful, make sure to like, share, and subscribe. Your support helps us bring more simple, science-based health explanations. And remember, never self-medicate with strong medicines. Always consult your doctor first.